Evening everyone. Today we will continue with our presentation on the radiological anatomy of the brain. This is the third part. The last part. Last time we were at this slide which is about the ventricles and the cisterns. So let's try just to refresh our memory. What is the ventricle A? What is it? A and B and C and D. Yeah, write it just to refresh. Okay, the A is lateral, exactly, the lateral ventricle. B is the third ventricle, exactly, and C is the fourth. No, this is not the fourth ventricle. C. Look carefully here, then here. D is the fourth ventricle. C is the aqueduct. Exactly. C is the cerebral aqueduct of Sylvius. So to sum up, this is the lateral ventricle located inside the cerebral hemispheres, and you can see the frontal horn, the occipital horn, and the temporal horn of the lateral ventricle, and from here it opens through the interventricular foramen of Monro into the third ventricle, and you can see in the middle the massa intermedia is seen, which is a non-neuronal connection, as we said in the last session. And the third ventricle communicates via this duct, this small duct, which is the Sylvian aqueduct located within the midbrain. It connects with the fourth ventricle here, and from the fourth ventricle it continues into the spinal canal. So, regarding the lateral ventricles, they are C-shaped. The limbs, the two limbs, this limb, the upper and lower limb, they face anteriorly, so it's a reversed C-shape, and they variably developed posterior extension from the midpoint. It means the occipital horn is not the same in all human beings. Some have prominent occipital horns, some have small occipital horns, rudimentary occipital horns. It differs from one to one, and they might even be asymmetrical, like the right occipital horn can be big and the left small, and vice versa. So it's composed of these parts: the frontal horn, which is anterior, located within the frontal lobe. The temporal horn is the inferior horn, and it is located within the temporal lobe of the brain. The body, or the antrum of the lateral ventricle, usually within the parietal lobe, and the occipital horn is located posteriorly within the parieto-occipital lobes. It joins the third ventricle by the foramen of Monro, which is located at the junction of the anterior horns and the body of the lateral ventricle. So let's look at this axial image, and we can see this is the lateral ventricle. Here it's a small size because there is no hydrocephalus. If there was a hydrocephalus, it will be distended, and you can see that here is the frontal horn of the lateral ventricle, and this would be the occipital horn of the lateral ventricle. If we go a little bit up, we can see this will be the body of the lateral ventricle, with connecting to the occipital horns bilaterally here and here, and also in the coronal image you can see the body of the lateral ventricle with the septum pellucidum in between. Okay. Regarding the frontal horn of the lateral ventricle, is the anterior horn and extends into the frontal lobe. The roof and the anterior extremity is lined, or it's under the corpus callosum. This is the corpus callosum, so the roof of it and the anterior aspect of the anterior horn of the lateral ventricle is covered, or it lies below the corpus callosum. Also, the medial wall is formed by the septum pellucidum. The floor and the lateral walls, this part is formed by the head of the caudate nucleus. It has no choroid plexus. There is no choroid plexus here. Before we go to the next slide, what is the name of this structure? This structure, can anybody remember? We said the name of this structure, the whole thing. Exactly. So this is the corpus striatum. As you can see, it is composed of the caudate nucleus and the lentiform nucleus with the striations between them located within the internal capsule. So this is the corpus striatum. Now, regarding the body of the lateral ventricle, it is located within the parietal lobe, like we said before. The roof and the lateral walls are also formed, by the corpus callosum and the fibers, its fibers, as it's similar to the frontal horn in this regard. The medially, it's the septum pellucidum. It has a choroid plexus. You can see choroid plexus here and the choroid plexus here. Regarding the temporal horn of the lateral ventricle, this is maybe of some clinical significance more than the rest. It extends into the temporal lobe and it curves down and laterally, then medially. Okay, first curves down, goes lateral, and then goes medial. The lateral wall is formed by the tapetum, while the floor is formed by the hippocampus. You can see this floor is the hippocampus. In the roof, there is the tail of the caudate nucleus. In the roof is the tail of the caudate nucleus. Starts here around the head, and then it curves like that, and the tail comes at the roof of the temporal horn of the lateral ventricle. This lateral temporal horn should normally be slit-like, very thin, okay, just like a slit. If hydrocephalus is present, the earliest sign is dilatation of the temporal horn. The temporal horn becomes more obvious, more dilated, more distended. This indicates early stage of hydrocephalus before the other lesion or the other abnormalities are apparent. So, in the coronal image, we can see this is the temporal horn of the lateral ventricle, and the floor of it is the hippocampus, while the roof is the tail of the caudate nucleus here, and you can see it is very thin and slit-like. Okay, and also at this axial image, you can see it's very thin and slit-like, and it's located within the temporal lobe of the cerebral hemisphere. Now, regarding the occipital horn of the lateral ventricle, it extends into the occipital lobe. It arises from the trigone at the posterior aspect of the body of the lateral ventricle. It's variably developed. Bilaterally well developed in only 18%. 18% of the population have bilaterally well developed occipital horns. So the majority of the population are asymmetrical or less well developed occipital horns. Unilaterally, if it's present unilaterally, it's more prominent on the left side more than the right. Also, it has no choroid plexus. By the way, temporal horn has a choroid plexus. So let's look here. We can see this is the occipital horn of the lateral ventricle, and you can see it extend posteriorly to the occipital lobe, and it is asymmetrically developed. Here on the left side, it is rather well developed, while on the right side, it's not very well developed, and this is a normal finding. There is no abnormality here. The lateral ventricle connects to the third ventricle via the interventricular foramen of Monro. So, what's the third ventricle? Third ventricle, it's a slit-like cavity that contains CSF. It's a slit-like, very thin. It is about 2 to 10 millimeter maximum width. This width is not more than 2 millimeters. So someone is asking which horns are not containing choroid plexuses. The frontal horn doesn't contain a choroid plexus, and the occipital horn doesn't contain a choroid plexus. The body of the lateral ventricle and the temporal horns, they contains the choroid plexuses. The body of the lateral ventricle the choroid plexus extends posteriorly, so some might suggest it's in the occipital lobe. So it may be in the anterior aspect of the occipital lobe, but the main body of the choroid plexus is within the body of the lateral ventricle. Okay, so the one that does not contain are mainly the occipital and the frontal horns of the lateral ventricle. Again, to our topic, the third ventricle, it's not more than 10 millimeter in width maximum, and it's located between the thalami. You look for the thalamus on the right, and on the left side it is located between them. Inferiorly, the floor is the hypothalamic group. The hypothalamus forms the floor of the third ventricle. The anterior wall formed by the lamina terminalis. It has recesses, the superior recess and the inferior recess, the pineal recess and the suprapineal recess. The supraoptic recess is the superior one, which is the inferior extension limited by optic chiasm. It's the superior supraoptic recess extends inferiorly till the level of the optic chiasm. The pineal recess located between the two lamina of the stalk of the pineal gland and the suprapineal recess. The roof of the fourth ventricle anteriorly is the anterior commissure here, and the foramen of Monro and the column of the fornix, while posteriorly it's the body of the fornix. We will see some images later. Now, the third ventricle will connect with the third ventricle will connect with the fourth ventricle via this tiny duct, which is the cerebral aqueduct of Sylvius. It is located within the midbrain. Posterior to it is the tectum that contains the superior and inferior colliculi. Inferior or ventral to it is the tegmentum of the midbrain. The cerebral aqueduct of Sylvius will connect the third ventricle with the fourth ventricle here. So it's located posterior to the pons. You can see the floor is formed mostly by the pons and the upper part of the medulla oblongata. The floor has a diamond shape. You can see here, this is the floor. It has a diamond shape, which is, as we said, the posterior aspect of the medulla and of the pons and the medulla oblongata. The roof is formed by the superior and inferior cerebellar peduncles. This here, the superior cerebellar peduncle and the inferior cerebellar peduncle, and the cerebellum is at the mid part. It has three openings. There are two lateral foramina called the foramina of Luschka that drains into the pontine cistern, and one median foramen called the foramen of Magendie, which is located beneath the cerebellum that opens into the cisterna magna. It also has a choroid plexus. So, this is the fourth ventricle. As we said, the floor is formed mostly by the pons and upper part of the medulla, while the roof is formed by the cerebellum and the superior and inferior cerebellar peduncle. Like here, you can see this is the superior cerebellar peduncle and the inferior cerebellar peduncle. Most of the floor, which is diamond shaped, is formed by the pons and upper part of the medulla oblongata, and it's connected to the third ventricle via the cerebral aqueduct of Sylvius here, and it has three openings, two lateral openings like somewhere here and here, the foramina of Luschka, and one median opening, that is the foramen of Magendie. These subarachnoid cisterns are important spaces that we should know about. They contain CSF. They are lakes of CSF. First, we have to know, we will know a little bit about each of them. We have the cisterna magna, which is located behind the medulla and below the cerebellum. It receives CSF from the foramen of Magendie, okay, the Magendie foramen. and from here the CSF will continue with the spinal subarachnoid space, and superiorly also goes behind the cerebellum for a variable distance. It contains the vertebral artery and the posterior inferior cerebellar artery laterally. Okay. Pontine cistern. First, I think we can. This is the cisterna magna here, and it receives the CSF from the foramen of Magendie, continues with the spinal subarachnoid space, and continues up for a variable distance containing the vertebral artery and the pica, and it is the largest cistern. Some people have a normal variant of prominent cisterna magna called mega cisterna magna. This is a normal variant. Okay, regarding the pontine cistern, it is located between the clivus and the pons. The clivus, which is a bone, and the pons, which is part of the brainstem. It continues below with the cisterna magna, and above with the interpeduncular cistern. It contains the basilar artery and the pontine and the labyrinthine branches. Again, let's go to the lateral ridge here. This is the pontine or pre-pontine cistern, continues superiorly with the interpeduncular cistern, and it's located between the clivus, the bone here, and the pons. Okay. Regarding the interpeduncular cistern, the name is very indicative of its location. It is located between the cerebral peduncles. That's why it's called interpeduncular cistern. It continues below with the pontine cistern, and laterally with the ambient cistern, superiorly with the supraciliar cistern. Contains the posterior aspect of the circle of Willis, part of it, not the whole, but the posterior part of the circle of Willis. Also, we need to know another cistern, that's the quadrigeminal cistern, we also call the cistern of the great vein. It is located posterior to the quadrigeminal plate of the midbrain, and limited posteriorly by the tentorium and the falx cerebri, and it contains, or run in it, is the great cerebral vein of Galen. The ambient cistern, another cistern located around both sides of the midbrain, between the interpeduncular cistern anteriorly and the quadrigeminal cistern posteriorly. Okay, the posterior cerebral artery and the basal veins lies in its anterior parts. Let's go back to this. Okay, we have here the interpeduncular cistern. Okay, and here you can this is the pontine cistern here. We will see some other images, I'm sure. Okay, the supraciliar cistern, it is located above the pituitary fossa. Supraciliar, so it's above the cella torsica. It continues posteriorly with the interpeduncular cistern and extends laterally into the sylvian cistern at the lowest end of the sylvian fissure. Also, there is another cistern called the pericallosal cistern, which is located around the superior surface of the corpus callosum. It continues anteriorly and inferiorly with supraciliar and the chiasmatic cistern. Okay, anteriorly and inferiorly continues with the supraciliar cistern and the chiasmatic cistern, and posteriorly it is connected with the quadrigeminal cistern. So we have this diagram that shows the different cisterns of the brain. You can see here, this is the cisterna magna. Okay, and here you have the quadrigeminal plate. These are the quadri means four, so we have two superior colliculi, two inferior colliculi, so there are four colliculi. That's the quadrigeminal plate, so we have the quadrigeminal cistern here. Okay, the pontine cistern here, and we have superiorly the interpeduncular cistern and the supraciliar cistern. You have the callosal or pericallosal cistern somewhere around here. Okay, so these are the major cistern in this diagram. Let's look at some images. First of all, we have here the cisterna magna that we said it is the largest one. It contains the vertebral artery and the pica, the posterior inferior cerebellar artery. you can see as we go up, it gets a little bit smaller in size, okay? And you can see here the fourth ventricle, and here will be the pre-pontine or pontine cistern, okay? And then you can see here will be the ambient cistern, okay? These lateral parts, and the quadrigeminal cistern here. Again, let's look at other cuts. We have here the quadrigeminal cistern posterior to the quadrigeminal plate, and we have here the ambient cisterns laterally, and you can see here the interpeduncular cistern that continues inferiorly with the pontine or prepontine cistern, and it connects anteriorly with the suprasellar cistern. So this is the interpeduncular cistern and the suprasellar cistern. Let's talk a little bit about the territorial distribution. We talked about it in several times in the last presentation, but we will refresh for a few words to refresh our memory. The anterior cerebral artery, we have the middle cerebral artery and the posterior cerebral artery. The anterior cerebral artery, supplies the medial and the superolateral aspect of both cerebral hemispheres, and goes posteriorly all the way to the parieto-occipital surface. So it is paramedian, supplies the medial and the superolateral aspects of the hemispheres, okay? While the middle cerebral artery, it supplies most of the cerebral hemispheres, supplies the cortex, the insula, and the most lateral surface of the hemispheres, including the frontal lobe, parietal lobe, angular and superior temporal parts. Also, the striae supplies the basal ganglia, the anterior part of internal capsule, via perforator branches, small perforator branches, while posterior cerebral artery, it supplies the inferior surface of the occipital lobe and the inferior part of the temporal lobe posteriorly, the posterior aspect of the temporal lobe. Like we can see here, this will be the anterior cerebral artery, okay, goes into around the corpus callosum, supplying most of the median and the superolateral paramedian aspect of the cerebral hemisphere. And you can see here, this is the lateral aspect, the middle cerebral artery supplying most of the frontal lobe, of the parietal lobe, even of the occipital and the temporal lobe. And this is the area of the supply of the posterior cerebral artery, mainly the occipital lobe, the posterior part of the parietal lobe, and the posterior inferior parts of the temporal lobe. This is a color-coded representation of the blood supply of the cerebral hemispheres. You can see here the blue line is the anterior cerebral artery, the ACA. You can see it supplies the median aspect and the superolateral aspect of the cerebral hemispheres, posterior, from anterior to posterior, to the almost to the occipital lobe, okay? And this red one will be the area of the middle cerebral artery. You can see it's the frontal, parietal, and temporal lobes, or have parts supplied by the middle cerebral artery, okay? And the green one is the posterior cerebral artery. It supplies most of the posterior aspect, including the occipital lobe and the posterior part of the temporal lobe. So when you come anterior, there is the anterior images, there is no posterior cerebral artery, while if you go posteriorly, it will be more prominent. And finally, we have the anterior choroidal artery, supplies, it's part of the middle cerebral, or it's a branch of the middle cerebral artery, supplying the basal ganglia and the internal capsule. In this diagram, you can see the anterior cerebral artery that arises from internal carotid artery bilaterally, that bifurcates into anterior cerebral artery and middle cerebral artery, okay? The anterior cerebral artery and middle cerebral artery. The anterior cerebral arteries have anterior communicating artery, the ACOM, which is part of the circle of Willis, and then continues into the pericallosal sulcus as the pericallosal artery. Okay, here we have a branch that arises called the recurrent artery of Hubner. Here we can see the diagram representing the middle cerebral artery distribution. It arises from the internal carotid artery at the after it bifurcates into the anterior cerebral artery and the middle cerebral artery. Okay, the middle cerebral artery will at the level of the insula will divide into multiple branches supplying the adjacent cerebral cortex, and it has parts, the M1, M2, M3 and M4. You can read about it and what are the different which part is the M1, which part is the M2. I will not talk about it. So we have here the vertebro-basilar system. You can see here is the spinal cord forming the medulla oblongata, and then this here will be the pons and then the midbrain. So we have the vertebral artery right and left. Okay, they join together to form the basilar artery, and the basilar artery will bifurcate into two posterior cerebral arteries, the PCAs. The PCAs will communicate with the internal carotid artery here via the posterior communicating artery. So the posterior communicating artery will communicate with the internal cerebral artery bilaterally, and as we have here, the anterior communicating artery will form a complete circle that is called the circle of Willis. However, in most of the people, this circle is not complete. There is something missing. PCOM is missing, ACOM is missing. There are a lot of variations. Okay, so we have here the posterior inferior cerebellar artery that arises from the vertebral artery. Okay, PICA, the posterior inferior cerebellar artery arising from the vertebral artery, and then this is the pica, and then the ICA. The ICA is the anterior inferior cerebellar artery arising from the basilar artery. Okay, so we have pica from the vertebral, ICA from the basilar, then multiple small pontine branches supplying the pons, and you can see before it terminates there is a rather big branch called what? What's the name of this branch? Does anybody has any idea? This is the superior cerebellar artery. Exactly. So this is the superior cerebellar artery and the posterior cerebral artery. What is this structure between the superior cerebellar and the posterior cerebral? Between the superior cerebellar and the posterior cerebral artery, the PCA, there is a cranial nerve. Which cranial nerve located here? No. No. What nerve is located between the superior cerebral and the posterior cerebral and the superior cerebellar? Let's wait and see. No. Till now, no one is answering. Yeah, let's just enumerate the cranial nerves and see which one of them. Exactly, Niaz is had it. The oculomotor nerve is located here between the posterior cerebral and the superior cerebellar artery, the third cranial nerve, the oculomotor nerve. So when you have an abnormality here, for example an aneurysm or something like that, the oculomotor nerve will be involved or will compromise the function of the third cranial nerve. So according to what we have said, we can see that if an artery is occluded, the part of the brain that is supplied by this artery will be edematous, will go into infarction. You have a cerebral infarction at this part of the brain. So we can know which artery according to where is the abnormality, the location of the abnormality. We talked extensively about the cerebral, the CVA, the cerebral stroke. So we will just see the abnormality here, which part of that will be, which arterial territory is that. Here is the posterior cerebral artery. Exactly, this is an infarction at the area of the posterior cerebral artery involving the occipital lobe and possibly posterior part of the temporal lobe. Now, what about this one? This is a big one and very easy one and very common one, by the way. This is the middle cerebral artery. Exactly, the middle cerebral artery infarction or occlusion resulting in infarction of the area supplied by the middle cerebral artery, and you can see the sulci are effaced with edema, some compression of the lateral ventricle, midline shift, and all of the signs that we have talked in our presentation, the basic brain CT scan. Now, what about this one? Which artery is involved here? This is also the middle cerebral artery, supply just at a level inferior to this level. If we go inferiorly, also the part of the middle cerebral artery supplying the temporal lobe, not supplying the posterior part of the temporal lobe and the occipital lobe. So this is not the posterior cerebral artery, this is the middle cerebral artery infarction. Thank you very much. I hope you benefited from this presentation. See you later with other talks. Please keep reading and keep studying and stay home, stay safe. Wish luck to all of you. Thank you very much.